Take a look at this echocardiography of a patient with severe mitral regurgitation (MR). What could be the underlying cause of this MR? It is worth considering that an isolated mitral valve cleft isn't as rare as we might think. Let's delve into transesophageal echocardiography. A mitral valve cleft is a congenital slit-like defect of a mitral leaflet which can cause primary mitral regurgitation. Isolated mitral valve cleft is not rare, it's rarely recognized. A mitral cleft is actually one of the most repair-friendly causes of mitral regurgitation when diagnosed early. In every unexplained mitral regurgitation, a mitral valve cleft should be considered. In other words, whenever we are trying to figure out the cause of mitral regurgitation, a cleft might be the answer. Differentiating MR caused by a cleft from functional MR is crucial. This is because cleft-related MR is a primary valve disease that often requires early surgical intervention, whereas functional MR is secondary to left ventricular disease and typically responds to optimal medical therapy. Mislabeling cleft MR as functional MR can lead to delayed surgery and worse outcomes. It is important to note that diagnosing a mitral valve cleft with transesophageal echocardiography can be just as challenging as with transthoracic echocardiography. Without three-dimensional imaging, a mitral valve cleft can be misdiagnosed or misclassified, potentially leading to confusion for the surgeon. That's why it is said that a three-dimensional echo for mitral valve cleft is not optional. A mitral valve cleft is not exclusive to atrioventricular septal defect. It can occur either as an isolated lesion or alongside other congenital heart conditions, such as ostium primum ASD, subaortic stenosis, bicuspid aortic valve, or coarctation of the aorta. Although posterior clefts do exist, they are much less common. Most clefts are anterior and they are classically between A2 and A3 scallops. In conclusion, a mitral valve cleft is not rare and doesn't occur solely in AV canal defects. If transesophageal echocardiography didn't show it, it doesn't mean it's not there. A mitral valve cleft is an anatomical diagnosis, not a Doppler diagnosis, and anatomy demands a three-dimensional transesophageal echocardiography. If cleft MR misdiagnosed as functional MR, it can significantly impact the outcome.